I'm sure you saw the report out just a little while ago in the New York Times that internal documents at the administration suggest that there'll be a doubling of deaths in early June. Can you react to that report and whether it seems plausible?
We know that as we decrease social distancing, the virus hasn't disappeared, and we're going to get more cases, and we're going to get more deaths. That's a simple fact, that without a vaccine, without a highly effective treatment, deaths are going to continue. And the question has always been, will the hospitalization rate, will the level of people needing hospital-level care, will that exceed hospital capacity? And I think that's the issue that we've been trying to struggle with, that flattening the curve was really about preserving hospital capacity. And these deaths were going to occur, and they're going to occur at a faster rate as we get back to normal economic activity. And this is something that it shouldn't be a shock to people, but it is. The way that this was presented to the general public has been very bad from the very beginning of this pandemic.
So that's a kind of a terrifying thought. It suggests that, well, at least now we have the beds. Therefore, if states reopen and you get sick, well, there will be a potential bed. Should states reopen then, Doctor?
States need to look at what's going on locally in terms of the dynamics. Do they have the capacity to care for these people? Do they have contact tracers? Do they have diagnostic testing? And then they can start to remove some of the social distancing. And remember, it's not an all or none proposition. There are going to be certain things like mass gatherings that are really not going to be safe to have because of the number of cases that they have. But the fact is that we're going to have to come up with a way of dealing with this number of cases and this number of deaths until we get a vaccine. And that's why it's so important that we focus on vaccines and antivirals, because the virus doesn't disappear, doesn't change its behavior. It's still going to act the same as we open states. And states have to be careful about what they do. And there are places where it may be much more difficult to go back to full activity, like former hotspots. But there are other states that are in a much better position. But we shouldn't kind of paper over the fact that we will be getting deaths from these cases, the increased cases that are going to occur. It's just what this virus is going to do. And this is a societal discussion that we have to have over what is the right balance to strike here, because this virus is going to continue to act the way that it does, and we have to take the right actions.
We're just getting word out of Texas. In fact, Doctor, 884 fatalities in the last 24 hours. The case have risen now 2.5% to 32,332. Now, Texas is reopened, right? I mean, individual businesses are taking measures and making sure that there are social distancing measures in place for the most part, although I'm sure some feel they don't have to. So are we guaranteeing that fatalities will rise because of states reopening? I mean, given what you said, it seems like that's a fact.
Yeah, I do think it is a fact, and I think it's something that we have to accept that that's going to happen. And with Texas, for example, I wouldn't necessarily look at the deaths now and say this is a result of the reopening, because remember, deaths lag for about 2 weeks, and they haven't been open long enough for that to have been an impact. So there is a danger in trying to attribute the rise in cases or deaths right after opening and saying that was because of the opening, but really that was what happened 2 weeks ago. So that's one caveat there. But I do think that as people interact, they're going to transmit the virus, and vulnerable people are going to get infected, and some of them are going to die. And I think that you have to balance what goes on in the economy, because keeping the economy completely locked down is going to lead to other costs as well as deaths as well, because we know that cancer screenings for cervical, breast, and colon cancer are going down, vaccinations are going down, chemotherapy is being delayed. So there has to be this trade-off that we're unfortunately faced with, because the beginning part of this pandemic was managed so poorly in the United States that we're now stuck with the situation we're in.